All right, thank you so much for tuning in to our HealthLinks webinar series. Today, we're going to be talking about training and really trying to answer the question, will employee training solve your workplace issue? Just wanted to start with a little bit of information about us. HealthLinks is a mentoring program that champions health and safety at work. We offer evidence-based healthy workplace certification as well as advising to help organizations and team members achieve total worker health. We are a nonprofit based at the Center for Health, Work, and Environment at the Colorado School of Public Health. For those of you who are in our HealthLinks network, this should look familiar, but for those of you who are not, we do assess and advise on 6 different benchmarks as a part of our process that we go through with organizations. So just wanted to point out today that our topic of training falls under the engagement benchmark, where we ask what types of trainings and continuing education opportunities that you provide for employees. Quick agenda for today. We have our presentation by Kira Litvin. We also have a panel discussion with representatives from Tri-County Health Department and the University of Colorado Anschutz Medical Campus. We will then have some time for Q&A, so make sure to ask some questions. And then we'll have a quick closing with wrap up and information on what's coming next. Some general housekeeping before we get started. All participants will be kept on mute throughout the duration of the presentation. Please use the chat function for any technical issues that you may have. I'll be kind of floating here in the background ready to help you with that. If you have a question for our speaker or panelists, please utilize the Q&A box in the control panel of your screen. That's where we'll be pulling all the questions later when we get to that portion. This webinar is being recorded, and the link to the YouTube page will be sent out after this webinar in a follow-up email that will come out later this week. There will be a survey at the end of this webinar. It should just pop up on your screen as soon as you exit out. Please take a minute to complete this. It helps us to inform our future webinars. There's also a little bit of a change if you have attended our webinars in the past. This is also how you're going to claim your CHES credits. So please make sure to take that survey at the end, and you will be able to take a short quiz in order to get those CHES credits. We're also offering SHRM credits for this webinar, and information on how to claim that will be coming out in the follow-up email. All right, I'm very excited to introduce to you our speaker, Kira Litvin. Kira is the Continuing Education Coordinator providing project management, instructional design, administrative support, and outreach on behalf of the Center for Health, Work, and Environment's Continuing Education Program. She has a background in teaching English as a second language and information literacy in higher education. Prior to joining the center, Kira was an academic librarian developing research, instructional learning materials, and managing online library systems. Thanks so much, Kira, for being with us today, and I will let you take over.
Thank you. Give me just 1 second to get my screen set up here. Well, hello, everyone, and welcome to this talk, Will Employee Training Solve Your Workplace Issue? The short answer is usually no. According to human performance research, most training experts and the learning and development industry as a whole, a training session is usually the last possible solution for many workplace issues. Today, I will talk about the importance of analyzing workplace performance issues and introduce tools that can be used to determine what the right solution may be long before we get to training as a possible remedy. So hopefully by the end of this presentation, you'll come away with a new awareness of how to analyze the root cause of a workplace performance issue, consider a possible solution or solutions, and then we'll wrap up by talking about other forms of workplace learning aside from didactic training. So I'd like to start by asking you a question. Have you ever attended or participated in a training session that you never used in your work? Let's launch a quick poll and find out what your answer is to these questions. So I'll give it just about half a minute to, oh, and I'm seeing quite a lot of yeses so far. So please feel free to share the topic of the training that you're thinking of in the chat. You can use the chat feature to just tell us maybe what the topic is, or what the specific theme or skill possibly of the training was. I'd love to see what some of your responses are. But it certainly seems like we can all relate to having attended a training that we feel does not align with our work, or that is not relevant to our day-to-day job. Let's move on to define what I mean by training in today's talk. I think, can I click stop share? Sorry, I'm just going to close that there. Okay, so when we think about trainings that we've attended in person or done online, I'm sorry, at the moment, I can't really see what people are putting in the chat, but I hope that they're things along the same line. Many times we think about compliance courses such as HIPAA, FERPA, sexual harassment, cybersecurity, or any of those other annual required modules that we suffer through. Why do they feel so insufferable? Likely because we've done them before, the content is repeated verbatim, and there's no actual practice or practical component that challenges us in our day-to-day work. So before we get too far along, let me clarify what I mean by training. Here, I'm referring to workplace training. The purpose of training is to improve employee performance, skill, and/or knowledge aligned with a business objective or goal. The definition of workplace training is widely accepted among workplace trainers and instructional designers as being the cornerstone to learning that is meaningful both to employees and employers. Dr. Ruth Clark, an author, practitioner, and recognized specialist in instructional design and workplace training, emphasizes the element of this definition and the specific components such as employee or workplace performance and specific behaviors associated with skills needed to support organizational objectives. So what do we even mean by workplace performance issues? And so again, I'd like for you to share some examples of issues that have been raised in your workplace or have been suggested to you for training delivery. Please type them in the chat right now to share with each other so we have some clear ideas of what we're talking about. I'll pause for a few seconds to wait for those to come in. So I'm seeing some good comments coming in the chat, and these are great ideas for performance, and they're definitely ones that we can use as we continue throughout the chat. So keep sharing your ideas. I love to see them. They're really helpful, and I think they're helpful for you to have a dialogue with each other as we continue through. So let's move on to explore maybe why we should be concerned about the issue of training. So one answer may be because we're throwing the training against the employees and hoping like mad that it sticks. This quote comes from a Forbes article that I will discuss further in just a minute. I'm personally interested in this topic. As an instructional designer and educator, I want to know more about how to design and develop better workplace performance options that are meaningful and engaging for employees and actually solve business performance issues. So I continue to seek out answers, influencers, leading authorities on training, learning, and development. And the more I look and I find constant dissatisfaction from employers, trainers, and employees that training is not solving their problem. Every year, there seems to be surveys or articles that report on how much money is spent on workplace training, but how little seems to be realized in improved performance or return on investment. For example, Forbes reports in a September 2019 article, the same article from which that quote came from, that over $87.6 billion were spent on corporate training and development in the previous year, yet the outcomes, return on investment, or improved performance is not readily apparent. The article provides a very engaging scenario of a single corporate event, complete with free-flowing food, activities, and networking, but leads to the main question: what happens after the training event ends? The typical next step for most organizations is that nothing else happens, meaning that the training delivered or knowledge acquired has no direct impact on the work performed or there may be no follow-up, no ongoing coaching, input, or even evaluation of how the training event connects to the business objectives. Another interesting report from McKinsey and Company cites that only 40% of companies say that their learning strategy is aligned with business goals. So then for 60%, the learning has no explicit connection to the company's strategic objectives. Yet again, another point about how training investment, time, and effort may not be the right solution for a perceived workplace issue, or may not even enhance employee performance. So let's turn to another quote that I believe captures this issue. The danger in leaping from apparent problem to apparent solution is that large amounts of time and money can be spent in throwing training at a problem the training cannot solve. Robert Mager and Peter Pipe have long been the leading researchers and practitioners in the field of human performance, and they've spent their careers analyzing performance issues and helping organizations understand that non-training could solve most, if not all, performance problems. They're the leading authorities and most often cited for their work analyzing performance problems, originally published in 1983. They developed a comprehensive performance analysis flowchart to guide us through a systematic process of exploring the root cause of a perceived issue. And I say perceived because what this flowchart can help us understand is what we may think is the cause of a performance problem may not in fact be the real issue. Let's look at their flowchart. So before your mind explodes looking at something like this, it is actually very logical and systematic. It does seem daunting, and even Mager and Pipe say, don't be deceived by appearances. The formula is not that rigid. I also understand that you may not be able to clearly see each step of this flow chart, but what I'd like you to understand is that this process is a flow with questions to help you understand the problem at each stage. And you might simply find the solution very early on in this process. I've numbered the chart and added arrows to draw your attention to the direction. This flowchart begins at the top left with step 1. The very first step starts by identifying whose performance is concerning to you, and then describing the discrepancy or the gap between what you think the performance should be and what you see. The second step asks, is it worth pursuing? Or asking, what would happen if we left this issue alone? They offer some very entertaining as well as sober answers, but basically they advocate for checking if your expectations are realistic. They say sometimes a little probing will show that it's less costly to ignore the discrepancy than to do something about it. The next step, number 3, is applying what they call fast fixes. I'm going to look at this a bit more in depth in a few slides, but at this stage, there may be some fundamental barriers, such as invisible expectations, physical obstacles, and inadequate feedback that may be causing the performance discrepancy. So in other words, does the employee know what is expected? Does he or she have the equipment or resources to do the job? Does the employee get regular feedback on their performance? Step 4 looks more in depth at consequences, asking such questions as, is the desired performance punishing? Is poor performance rewarding? Or are performance consequences used effectively? As we move from the bottom of the first column to the top of the second column, we move from performance discrepancy to explore questions of skill deficiency. So remember that we may have already found a solution long before we begin looking at actual skill deficiency. And as we answer questions in step 5, we may find that the skill deficiency may be a matter of forgotten skills, or steps, or even infrequently used skills, either which may only need a small or slight intervention or refresher. Finally, at step 6, we're asking the questions and probing for any potential obstacles overlooked. They urge us to ensure that you have not been lured off course by any unrecognized assumptions, biases, or myths that may be interfering. Are there other causes? Can the task be made easier? Are there other obstacles? Do the employees have the potential to change? I'm certainly not an expert at working through this flowchart, either myself or with managers or leaders. I believe it's something that takes practice. I really recommend reading their book to learn more about the questions and considerations at each stage. But my hope in discussing this flowchart is to present a tool that provides many other solutions long before we get to designing and delivering training. Let's turn now to consider how a version of one of these conversations might play out. Let's turn to a practical example from Kathy Moore, a training designer, consultant, and speaker. She provides practical scenarios and solutions for performance questions. She uses a modified version of Mager and Pipe's flowchart, which she calls action mapping. One of her scenarios, called It's New, so everyone needs training on it, offers a good example of how such a performance analysis conversation might play out between a manager and a trainer. And I have a volunteer to help perform this scenario with me on the next slide. So it begins with,
please train everyone on the new TPS software by June 1st.
your manager expects to hear, sure, I'm on it. Instead, you offer, why?
Because people were messing up their reports in the old software.
Why were people messing up their reports in the old software?
You know, it was confusing to use. The new software walks people through the process a lot more clearly.
So the new software is easier to use.
Yeah, it's a lot easier.
And everyone who'll be using it is already familiar with the old software.
Yep, they've all been entering TPS reports for years.
All right, so do you agree with the manager that everyone needs training on the new software? Let's launch a poll to find out. Just give it a few seconds for everybody to register their answer. It seems like our no's and maybes are kind of neck and neck. Quite interesting. So Kathy Moore would suggest the following. Give the new software to a few typical TPS report creators or employees and watch them figure it out. Their struggles or their lack of struggle will show what support they really need. A help screen or a short reference is likely to be enough training in this case. This process is what is typically called a task or a job analysis, to observe and get feedback from employees on what they do and what they may need. In this particular case, the performance problem was errors in the reports. You might, if you are an Office Space fan, you might recognize the TPS report from that movie. If not, don't worry about it. But in any case, remember that the performance problem was that people were making errors in their reports. A new software was provided as the solution. So whether or not employees need training on this new software that actually may help improve their job task is something that may need more analysis before we jump to the solution of training. The other thing I'd like to point out is that Mager and Pipe actually tell us that it doesn't get you very far to directly tell a manager or supervisor or whomever is asking for the training that his or her diagnosis is probably wrong. However, it may work better to agree that there is a problem and then do your analysis out loud, as we saw in that scenario, hoping that the manager will recognize that another solution or alternative before making the leap to training. One of the things that you may have also recognized in the previous scenario are the 5 whys, or the whys in this scenario. The 5 whys is a questioning technique that's used to explore cause and effect relationships underlying a particular problem. The primary goal is to cut through the outward symptoms of a problem to discover the underlying causes. This has been developed by Seikichi Toiwada, founder of Toyota Industries, dating back to the 1930s. The way this works is you gather a team, define the problem, ask why 5 times to discover countermeasures or corrective actions. You would then take those actions and then reevaluate whether the performance problem or the issue has been resolved. And if not, you would come back and maybe work through this process again. It may appear to be simple, but by asking questions about why something happened, the goal is to reveal the underlying issues. I do caution against leading to predisposed direction. Mager and Pipe also warn us of the hazards of considering only one possible solution to any problem. And they recommend running your problem through all the steps, either in their flowchart or through this 5 whys, before you decide that your analysis is complete. So keep in mind that the 5 whys forms the underlying basis of most root cause analysis. So I'd like to return to Mager and Pipe's step 3, fast fixes. I use this quote again to remind us that often what is identified as the problem isn't the problem at all. Mager and Pipe tell us that maybe the underlying issue of the statement, "I've got a training problem," is that when a difference is perceived between what someone is doing and what others would like that person to be doing, they conclude that the way to reduce that difference is by training or by providing instruction. However, they caution us to remember that training is only one of the remedies and may still be only one of the many solutions, even if there's actually a skill deficiency. So to recap, before we reach step 3, the fast fixes, we will have completed steps 1 and 2. You will have described whose performance is concerning you, described the discrepancy, and determined if it's worth pursuing. At step 3, you would begin with asking, are the expectations clear? Does the employee know what is expected? Have expectations been discussed? If not, then you may pause here and have that conversation and reevaluate performance. Does he or she have the resources, tools, or equipment to do the job? This may seem obvious, but it's often overlooked. And then consider, is performance quality visible? Or does the employee or even the manager know what a top performer or optimal performance looks like? Are there examples? Are there models provided on what is good performance or when it could be improved? These fast fixes may be the very solution needed to improve performance without holding a training session. Finally, I'd like to place this talk today about training in the wider context of workplace learning, which has been receiving much more attention in learning and development discussions in the past few years. Just because we're not offering a training session or a course doesn't mean that we can't encourage learning opportunities. Developing an organizational culture that supports lifelong learning and professional development can help drive engagement and retention. The key to engagement may be in empowering employees to take responsibility for their own learning, aligned with the overall business goal or learning strategy for the organization. Many training experts situate training or didactic instruction within a framework. Here I'm sharing an adapted form from Jane Hart's 4Ds of learning. We've already discussed didactic or training. There's also discovery or informal learning. There's discourse or social learning, which means interacting with others or sharing information with others, such as other employees, and doing or experiential learning, delving into organizational culture of workplace learning may be a talk for another day. So before I end my talk, I'd like to find out a little bit more about what your organization is currently doing for workplace learning, and let's launch our last poll. So does your workplace currently offer the following workplace learning opportunities? So you can check all that apply. Give it another few seconds for people to register their votes. It's very interesting. Thank you for sharing your answers here. I'd love to know more about others. So if you have other, please feel free to add them in the chat. I'd like to see what some of those others are, if you have other comments about the polls. So I'm going to go ahead and end my portion of the talk here, and now we can move on to have a short discussion with our panelists, and then also address some of your questions as well. So I'd like to invite the panelists to share their webcams, share their audio, and I'm going to introduce them. So we have 3 panelists joining us today to share their experience and perspectives on training and workplace learning. We have Tanisha DeBose is the Workforce Development Coordinator for the Tri-County Health Department, a local public health agency that serves Adams, Arapahoe, and Douglas counties. Her role encompasses training design and delivery, partnership building, and creating access to professional learning and development opportunities for her staff. She has several years of experience applying blended instructional design using multiple virtual and face-to-face delivery methods. Next, we have Debbie Lammers as the Director of Learning and Development at the University of Colorado, Denver and Anschutz campus, and she's been with the University of Colorado since March 2018. She received both her undergraduate and MBA from the University of Colorado, Denver, and has over 20 years of experience in organizational development, leadership, and coaching, and change management. And we also have Caitlin Norris from the same department. She serves as the training coordinator in the Central Human Resource Office at the University of Colorado, Denver and Anschutz campus. She joined the Learning and Development team in April 2019. Prior to this, Caitlin worked in talent management and recruitment at the Anschutz Medical Campus and Illinois State University. Her educational background includes a bachelor's degree in human resources and Spanish, as well as an MBA. Caitlin considers herself a lifelong learner and loves helping others grow and develop at CU. I'm just going to move this over to my other screen. Thank you very much for joining us. So one of the first questions that I wanted to find out from you is, could you tell us about a time when you delivered a training session that you felt was successful? And how did you know it was successful? What factors made it successful? I guess I could call on people. Tanisha, did you have something that you wanted to share about this topic? You can unmute yourself.
Okay, there we go. So in regards to, delivering a training that in my eyes came or was perceived to be successful. So we recently actually implemented a learning management system across our agency. And so that was back in January that we did that. And we actually have been doing some evaluations to assess, usage as far as like trainings that have been implemented into or integrated into the learning management system itself. And we've actually been getting a lot of good feedback. And I think some of the factors that play into that is, one, the accessibility of training, really having a convenient spot for people to actually have access to trainings, especially now with COVID. It's really hard to conduct anything that's in person due to having social distancing orders in place. And I think it couldn't have come at a better time to actually have this tool available. And then it also has pushed a lot of people within our organization to actually start leaning into e-learning and developing content within that platform.
I just have a quick question. So is the training that you're offering in the LMS, is it all required, or is it on demand so that employees can make choices about what they want, or is it a mix?
Yeah, so we do have some customized trainings that we've developed in-house, but we also have a contract with Skillsoft Enterprises. So we've actually purchased a catalog through them. And that's how we actually have, like in our library, you can kind of self-select through that process and kind of determine what your needs. And it's also put into like a performance metric. Say, for instance, if your supervisor is kind of assessing that there might be a need there, they can actually push you to go into the LMS and decide on what courses might be a best fit for you.
That definitely seems like a trend that I've noticed in training and development lately. So Caitlin or Debbie, did you have something that you would like to share about successful training or follow up to Tanisha?
Sure, I'll jump in. We do both. We do a lot of on-demand training, but we also still, we did have to turn on a dime right away after COVID and take a lot of what we do, what we were doing in person, and figure out how do we do that virtually. So we spent hundreds of hours converting our in-person training to Zoom friendly. And recently we started offering a lot of the Franklin Covey in a Zoom environment. And one of the big ones has been 5 choices of extraordinary productivity, because people have been struggling with how do I now merge my home and my work life together. And the very first session we had was very gratifying to us as a team, because we did it over 3 different sessions, and we were finding that even in the session, people were like, oh my gosh, I can apply this doing X, Y, and Z. And by the time the next session would happen, people were like, I was a diehard doing everything in paper, and now I've converted everything to Outlook, and it's made this big of a difference for me. And these were doctors telling us this from one class to the next. And it was like, wow, if we could get a doctor to go from paper files to online, it was like, wow, that was a big win for us. So just hearing the stories and the success stories that they would tell us in class or after the fact, just send us a note and say, this has been life-changing for me. I've been able to incorporate it at home and in person, was like, wow, that really shows that it was something that was very practical and something that they could put in use and see a significant difference in what they were doing right now and not 3 months from now. So that was very gratifying for us as a team to be able to see that being a success immediately.
Yeah, definitely. And is this like what I would call on demand, so that employees can select or choose to do this training?
Yeah, absolutely. So what we do is we schedule out offerings that throughout the year people can self-select to enroll in the class throughout the year, and they pick and choose what they want to go to. So we typically offer, we have an offering of about 28 different courses that we offer throughout the year. And they pick and choose. And on an average in a year, we have about 1,700 people attend classes throughout the year.
That's great. Yeah. Caitlin, did you have something to share on this topic?
Yeah, I can add in a little bit as well, just to kind of play off what Debbie was saying too. I love the 5 choices that she was talking about. And I think another class that we've also seen a lot of interest in, a lot of people really wanting to take that we're offering. And again, this is kind of the on-demand, you can choose what classes you want to come to, is a foundational class that we do in Project Management Essentials. That one we've heard a lot of really positive reviews on. We do send out post-course surveys to people as well, just to kind of gauge, was this useful? Was it good use of your time? Do you think you'll use it going forward? And we heard really, really positive reviews on that one as well. And things just kind of clicking for people, because it lays out the foundations in a way that's really easy to understand. So I would say that's another class that I'm really excited to teach, and something that I think we've seen really positive remarks from other people that have attended throughout the year.
So do you think that makes a difference in when employees get to choose what kinds of trainings that they're attending versus when they're told to attend something? Do you think that makes a difference in the engagement or participation?
I'll jump in. I think so. Sometimes we joke when we say we could tell who's being held hostage if they've been told that they have to attend a certain class because of a performance issue or because of a performance improvement plan of some sort. Some of those are begrudgingly going to those classes at times. Not to say that they don't need the class, but you could usually tell that it's not by their choice. Usually they either think that they don't need to be there, or it's because they've been told. But I think where we see the biggest gratification is when somebody says, I really want to do this. Or if it's something that we work with several different departments that learning is really ingrained in the culture of the department, and they get the entire team together. And so we do very customized training for different departments, and it's really great to see the journey of that particular department, where we do a lot of different specialized classes with them, and you see the growth in those individuals over time, and it's on a variety of topics. And so you can actually see, I think personally, you can see the difference when it's something that they really want to learn and it comes from upper management versus, and that's that culture there that they're encouraging that versus being told to do it.
Right. Yeah. Definitely. So is there a time, I think we've kind of touched on this a little bit, but I'm kind of curious about a time when you were asked to design or deliver a training that you felt was not the right solution. Maybe what did you do? Were you able to turn it around, or what was the outcome?
Well, I can answer it. Yes. Over the years that I've been doing this, similar to your scenario where it's like, oh, the answer is let's do training. And a lot of times training isn't the answer. And what I prefer to do, because I do a lot of coaching and a lot of organizational development work as well, is I will ask those questions first. And I do teach 5 whys and continuous improvement on top of it. So I'll ask those 5 whys to really try to get to the root causes. Is it really an employee relations issue? Is it really something that you need to have a conversation with the person? Have you really addressed it? And a lot of times you can get to that root cause to find out it's not a training issue. It's more or less, have you had those conversations and you've set those expectations? And we've come around to the decision that really it's not a training issue. It's more of having that really honest conversation with someone, especially if it's around performance. Or is it that you haven't addressed that somebody is having issues entering information into the system because it's a one-off person not having the right training or the right tools to do something. So I'm a firm believer of asking the questions before I decide it's really a training issue.
I think that's something that takes a lot of experience to be able to ask the right questions at the right time in that conversation. Right, Caitlin or Tanisha, do you have experience with doing that, or any kind of like successes with being able to turn around that conversation, or?
Yeah, just to kind of piggyback off of what Debbie said, one of the struggles that we've had as an organization is we've been doing case investigations and contact tracing training, which initially it sounded like training was the ideal solution as far as like, this is a very rapid or evolving process as far as getting volunteers up to speed on how to conduct a case or do contact tracing in general. And what we found out is that we have been experiencing a lot of performance issues. Just to kind of relay some of maybe the proponents of what's actually boosting that is we have such this limited amount of time. I think we're training these employees within like a week time span, and that's not enough. And so what we've actually tried to solicit is, providing more feedback. If there's one-off situations where, someone is entering data incorrectly into the system, kind of doing some coaching counseling with them on the side and trying to address those issues with that person individually. But we've noticed that training is probably not the best idea going back into a space of training, but actually addressing performance issues as they are occurring naturally within our organization, along with the contact tracers and case investigators.
Great, thanks for sharing that. It's a really good example and way to kind of realize and kind of pivot, what can we do to work with that individual person maybe who has that particular discrepancy, and like how can we improve that? Caitlin, did you have something that you wanted to share about this too?
Yeah, I'll add something real quick. So this actually comes from a prior role that I had more on the recruitment side, but we had done and offered and kind of built this training for essentially our HR business partners. So kind of think about it from that perspective, people that do job descriptions, but they may or may not be doing them all the time. So we had developed this training in that role as kind of our subject matter experts to help them really craft good job descriptions, figure out qualifications, things that would be really helpful. And while the training was really successful, I don't think it actually solved the problem, kind of hindsight being 2020, because the people that we really wanted to come were the ones that thought they didn't need it. So kind of that interesting, well, we really think you should come. And they're like, no, I think I'm good. I think I got it. And you're like, oh, I don't think you do, but okay. So that's kind of one of the ones I think about, that, the training was really good and it was helpful, but perhaps the audience or how we got people to come may not have been the best course of action.
So how to recruit the reluctant trainee or the person who doesn't think that they need the training to convince them that maybe they could benefit. Yeah, definitely. Yeah. I think that we touched on this just a little bit, but I'm kind of curious of maybe suggestions that you might have for how organizations can encourage employee ownership for learning. And I think that Debbie kind of touched on this just a little bit, and Tanisha also with your kind of on-demand. But are there other kinds of suggestions that you could pose for organizations or even trainers or HR professionals and how they can help develop that kind of ownership?
I think one thing that we've tried to do as an organization is really put some of the onus on our supervisors and managers to really cultivate this idea of a learning culture. And so one thing that we've actually done is we're revamping our performance evaluation form and process. And we're actually including a learning element or aspect for goal setting into our performance evaluation. So we actually encourage that. And we want our employees to actually be the one who is generating those performance objectives that are related to their own professional development along the lines of learning.
That's great. Sorry, I was distracted by Slack notifications. I apologize. I should have turned those off. And I was trying to get them off. So I'm curious, like, will you have a process for reevaluating or evaluating how that goes in the future?
Yeah, so I think what we want to do is, so currently within our performance evaluation, we don't really focus in on goal setting. So what we've done is integrated on like a quarterly basis. You have a one-on-one check-in with your supervisor that's directly geared towards focusing in on your objectives. And so as an HR, because I live in HR, and what we're planning to do is do some audits within our divisions to assess whether or not, one, the employee is meeting their learning objective. And then we also have some staff engagement surveys too that will be going out in regards to employees engaging within the process.
Great, thank you. Caitlin or Debbie, did you have something you could share about that?
I don't know. I think Debbie and I are both thinking on this one, coming from the same team and the same department. Yeah, I'll let you go ahead and go, Debbie.
Yeah, I mean, it's interesting being on a university campus and, thinking about a learning culture. You would think it was already naturally ingrained within the culture. Some places it really is, and in some pockets of the university, not so much. But I think, the 2.5 years that I've been with the university, I see kind of a shift going on because prior to me coming on board with the university, there truly wasn't, at least on Denver and Anschutz, there was not a learning and development department that was focused on providing professional development for staff and faculty. And so one of the biggest complaints through staff council was there's not a lot of professional development offered for staff and faculty. And so my primary goal was to figure out, how do I change that perception and how do I show the value of what learning and development can bring to the university? And it has really expanded a lot. I mean, as I mentioned earlier, we average now about 1,700 people going through our classes in a year, and that's just our general classes. When I started, we might have 500 people go through a class, and we offered about 11 classes. Now we keep on getting requests for how much more can you provide, and we hear that people are really wanting more and asking for more, and it's even coming from executive leadership. I mean, we just recently got the approval to officially launch a manager certification program, which provides a competency-based roadmap for people who are currently managers or want to look at becoming a manager with the foundation to be a successful manager. We just launched that right after Labor Day, which is something that was unheard of before. Wow. So I really see the change happening. To me, because coming from private industry, it seemed a little slow. It was like no brainer, but it's getting there, and it's really being well received. So it's exciting to see that shift in thinking.
Definitely. Yeah, that sounds great. Well, thank you. I think we're going to shift now to taking some Q&A from our attendees.
All right. Thank you all for posting your questions. If you continue to have questions, please use the Q&A function for this portion, and we'll go ahead and get started. So one question that has kind of been popping up in a few different ways is about adjusting for different learning styles. And in particular, someone asked specifically about having people with various ages and abilities in terms of technology, and how do you kind of accommodate for all of those different styles and ages?
Well, I'd probably go back to Mager and Pipe's flowchart and consider the person where the discrepancy may seem to be with. And so then your solution or problem would be focused on that particular person. So we're not talking about one training that's covering 10, 15, 30, 50 different people that may have different needs, but that we're talking about a particular performance issue with a particular person, and then looking at what those solutions may be using the flowchart. But does someone else have a different response based on maybe on-demand training that you're offering and what other considerations there may be?
I could add in a little bit to this one, not so much from an age perspective, maybe a generational perspective, but kind of how we transitioned what was in-person classes prior to COVID to being Zoom compatible classes. What we had really tried to do, and I think we're continuously trying to improve upon this too, is really get people involved, because we know that over Zoom and virtual classrooms can be challenging. So right at the beginning, and Debbie, you're probably going to echo this too and think about it, it was something that was really hard for us because we couldn't gauge people's engagement because people would have their videos off. It was hard to get people to unmute themselves because maybe they weren't comfortable in that environment. So what we had really tried to do is target different learning styles and people's comfort levels. So in all of our classes that we offer via Zoom, we offer people to use chat if they feel comfortable typing. We offer them to turn on their video or keep it off depending on comfort level and then just kind of what's going on in their environment. We also use a raise hand feature if they don't necessarily feel uncomfortable unmuting right away, but they want to be called on. So kind of from that perspective, we were able to tailor based on feedback that we had gotten from folks that maybe the way that they learn or the way that they want to communicate in a virtual environment, they just need different options. So hopefully that kind of answers the question as well. And it's something that we've experienced, especially, March moving forward.
Yeah, that's great. Thank you so much. Another question that has come in is about these kind of required training. So things like harassment, diversity training. How do you make these more engaging and effective for participants?
I think that, sorry, go ahead.
Yeah, those are always a fun one to try to make engaging. So even though those aren't done out of our department, but we do help and consult with that. And I help a lot with our online side of it. One of the things I really try to help emphasize is anything that we're trying to do compliance-wise that has an online required component is look at how much interaction can you have. Going from the let's just read slide after slide after slide after slide and allow a person to skip to the end and take a quiz. And if you don't pass the quiz, go back and take it again as many times as you can until you pass. We've added a lot of touch points where there's scenarios, there's matching, there's a lot of other things going on that keeps you engaged in it. Maybe a few different videos involved in there from that standpoint. But we're also offering online version as well as an in-person version where if you prefer to do that where you could ask questions and have scenarios and do small group type things, we're trying to do them both ways because we're trying to take into consideration the learner, because some people are like, I just really don't like to do online training and I really want to be able to ask live questions. So we give them both alternatives in most cases. It's just really, it's a hard one because it is what it is. And we know we need to do it, and it's not usually the easiest to engage in however you do it, but finding just those little ways, I think, to engage people in different types of scenarios, and even finding engaging sort of videos that gets the same point across without having all the words on the screen, right? And just trying to read, I think, helps out a lot.
Definitely. I definitely echo what Debbie said. I think engagement is key. Interaction, having to make choices and decisions that are complex and that are not just like letting you turn off your brain and just go through the multiple choice questions that seem. So there are so many ways that compliance training can be more engaging. And I did mention that in my talk. And that's probably a training for another day if we want to have more training. But there's definitely so many other ways that compliance training can be so much better than what it typically is. It does not have to be as bad as what it is. So finding ways to use real scenarios, real stories to make real decisions about those issues is really the key.
Great, thank you all so much. Another question that has come in is, beyond individual performance improvement, can any of the panelists share learning experiences focused on collective and organizational learning and evaluating the impact of those efforts? I don't know if anyone wants to take a stab.
Okay, well, that's also another big training topic and that we could do a lot on. And I'll use an example from my previous life because I spent a lot of years putting that together with programs, and it's usually the hardest thing to do a return on investment or the organizational impact. But the best I think I've ever come close to doing that is I selectively would look at which programs did I really, really want to look at the organizational impact that I knew I could take the results and trace it back to organizational impact or effectiveness of the employee. And I would do a phased approach. You know, I would take Kirkpatrick's levels and take a look at not only just the smiley sheets, but we did pre and post tests of the programs. And I also did behavior analysis before with both the participant and the manager, and then afterwards. And there would be 3 months, 6 month, and an annual to look at how did things change and did that learning stick with the person well beyond 3 to 6 months afterwards, so that we could really put together, well, if it took me 6 hours to do that same function before I went to training, and now it's taking me 2 hours a year later, and I could figure out the average salary or hourly salary of that person, I could show to the organization, this is how much money we've saved you by this person going through the training. But I made it very selective, because it really takes a lot of manpower to come up with those numbers. I could also take it back, because I worked in heavy industrial construction, and if we did a lot of safety training, I could also take it back and look at what was the reduction in safety instances. So again, it was really selective to look at the impact on what we were doing and what we were training to see where that went to. So it's hard, and you just really got to take a solid look at and talk to executive leadership. What do they really want to measure, and target that and start small, because it could take you down a rabbit hole, at least for me anyways.
Yeah, and that was something that I definitely wanted to include in this talk. You need to be selective about how much we could talk about, but using Kirkpatrick's levels and beginning with level 4 as what is going to be your objective. How do you want to reduce how many safety incidents you want to reduce, and then you're going to work down and backwards to your smiley sheets in developing your training along with your needs analysis, so that you're starting with the business objective and you're knowing how you're going to be able to meet that objective, and then designing your delivery and your training. So that's again another topic for another webinar, is to talk about evaluation and how you incorporate evaluation into your design and planning from the start, which I think is really important.
Tanisha and Caitlin, do you have anything to add?
I think just kind of piggybacking off of what Kira and Debbie said, one thing that we utilize internally as an organization, we have a performance management system. So we all have, within our programs and divisions, we have collective dashboards. And I think that's really helpful to inform some of the training needs that might be arising, or if there's some performance issues, if we're not meeting our targets, what we could do to actually boost that up. So I would highly encourage, it is a lot, like an elongated process to develop, but to have programmatic dashboards is really, really helpful.
Great. Well, thank you all so much. We got a lot of good questions in, and of course, don't have time to get to all of them, but wanted to let all of the participants know that if you do have more questions, I'm happy to connect you to Kira or our panelists, and you can potentially reach out via email to get those answers. So thank you so much. I'm just gonna do a quick wrap up here with some information on things coming up and how to claim credits. All right. Oh, sorry about that. Work through here. Okay, so wanted to first tell you a little bit more about HealthLinks. I know we talked at the beginning about this, but just wanted to point out, especially with COVID going on, that we recognize health and safety in the workplace is more important now than ever, and we are here to help if you need that at all. So we have plans starting at $180 that include a assessment as well as a one-on-one advising session. You will get a unique action plan and goal definition for things that you want to work on as an organization for the year ahead. We also provide healthy workplace certification if you reach a certain level in your assessment. And of course, we have access to evidence-based resources and education. So feel free to visit our website, healthlinkcertified.org, or again, you can reply to any email that you've received about the webinar, and that will go to me. So I'm happy to answer any questions you have. Our next kind of big workshop that we have coming up is on stress management. This will be on October 15th, and it's an interactive workshop with Dr. Gwen Fisher from Colorado State University. This is a longer training, about 4 hours, so this does have a bit of a cost to it, but you are able to get 4 CHES and SHRM credits, and I believe that David will be posting the link to that, yep, in the chat. Fantastic. So feel free to check that out. We'll also be sending the registration link in the follow-up email just in case you missed it. Lastly, just wanted to say thank you so much for tuning in with us today. Again, if you can please take a minute to complete the survey, we would really appreciate that. That's also how you will get your CHES credits. So definitely be sure to do that. It should pop up right on your screen when we end the webinar. Also, if you wanted a certificate of attendance, you can do that within the survey as well. If you are looking for SHRM credits, however, those will be coming out in the follow-up email that should reach your inbox later this week. Again, if you have any questions, reply to one of the emails you got about the webinar, or you can reach us at contact@healthlinkcertified.org. Thank you all so much for being here, and we hope you have a great rest of your Wednesday.